Now, the gruesome rape and murder of a practicing doctor has united the entire medical fraternity, which is on the streets demanding justice, both for the victim and their profession. Now, while the Indian Medical Association's one-day strike has ended, the medical body and other such groups have warned of resuming protests if their demands are not met. The IMA has written a letter to the Prime Minister Narendra Modi on similar lines to the one that they wrote to the Home Minister. The IMA is demanding that a central act be enforced to protect medical practitioners against violence. They're also seeking high-level security at hospitals, similar to what we see in airports. With nationwide protests affecting healthcare services, the Health Ministry has urged the protesting doctors to call off their stir. The centre has also promised to form a panel that will suggest measures to ensure safety of healthcare professionals.
So the call which was given by the Indian Medical Association for doctors to observe the suspension of services, that is something which is currently being observed in parts of the capital city. Currently we are reporting from the Safdarjung Hospital, which is one of the prominent healthcare facility in New Delhi, and you can see that this is the picture which is coming in right at this place, because the call has been given for the protest, for the suspension of services. So the patients are the ones who are facing the brunt, and to keep a check on the overall safety and security, the paramilitary forces have also been deployed right outside the OPD chamber here at the Safdarjung Hospital, and in fact we can see some of the women personnel as well. They have been equally deployed here. So on one side, the doctors across the nation, be it from the private facility or the public facility, they are protesting right on the streets. On the other side, the patients are the ones who are facing the. Let's take a quick view from the patients. आपको तकलीफ हुई है अभी तक? आप सफदरजंग में आए हैं, ओपीडी जैसा कि बताया गया है कि हड़ताल है कि आज नहीं होगा, प्रॉब्लम हो रही है?
प्रॉब्लम हो रही है, भीड़ बहुत है इस समय। इसमें भीड़ बहुत है, नंबर लगा रखे हैं, कम से कम 200 आदमी के बाद का नंबर है।
200 आदमी, so you can imagine the plight of the people who have come here. In fact, we have spoken to some of the people who have told us that even the basic facilities are being denied by those people who are in charge of here.
You know, of course, the strike, much like in other parts of the country, has continued over here in Bengaluru as well at the Nimhans hospital that, you know, we've been reporting from for the past about 5 days now, almost, you know, so to speak. Of course, even as doctors here continue to sit on strike, their demands are quite clear, that they just want safer working spaces in hospitals right now. And as far as, of course, you know, the protests over here are concerned, it doesn't seem like it's going to be stopping anytime soon. We're, of course, you know, seeing the manner in which the doctors have been protesting now across the country, not just in Bengaluru. Of course, this is a call that's been given now by the IMA as well. We'll try and quickly speak with a couple of doctors over here now and understand from them how the stir is intensified and when really, of course, you know, we're going to be seeing some resolution from the government. If I can ask you, doctor, we're seeing that it's a nationwide strike that's been on now. It'll be completing a week very soon. I want to ask you, with all OPD services remaining shut across the country today, are you hopeful that the government would hear the message of doctors loud and clear?
Yes, sir. That IMA has also joined the protest and called for a 24-hour strike. We are hoping that it stirs up something from within the government and it compels them to come ahead and take a decision regarding this issue.
Okay. Doctor, I want to ask you as well, you know, I have to ask you, we're seeing how are women doctors reacting to strike across, you know, there's a lot of solidarity that's come through now, whether it's been from the IMA or the other bodies. Are you hopeful that the government would give in to the demands and hospitals would be made safer spaces for women to work at?
The fight that we're doing today is just not about today, right? It's been past so many years. The fight is not only about women doctors, also about the nation, the world, for everybody, just not like women or men as such, right? We have seen, we are hopeful, we are resilient. History has showed us that if we all stand together, if the entire nation, the entire world stands together, the people in power are bound to bend down.
Passing over to my colleague Abhishek now. Abhishek, let us know what's taking place today and tomorrow when it comes to the planned doctor protests.
See, definitely, you know, after the IMA calling a nationwide strike, similar support can be viewed from the Mumbai that is the BMC MARD, that is the Resident Doctors Association, and other medical associations have openly supported it. And we have seen the massive protest on 16th of August in the Azad Maidan. And after that, from the past 2 days, respective hospitals, the resident doctors, senior doctors are protesting. OPDs are shut. At the same time, elective surgeries are not happening. Only the emergency cases are being handled. Moreover, the representative of the resident doctor met Chief Minister Eknath Shinde, after which Chief Minister Eknath Shinde also spoke to the Union Head Minister JP Nadda regarding their demands, focusing on demanding justice to the female doctor who was brutally raped and murdered. At the same time, implementation of the Central Protection Act is the main demand of these doctors. And yesterday also, they made a point after the appeal from the Chief Minister Eknath Shinde that kindly call off your strike, get back to work, run the OPDs, do the elective surgeries. But it was made a point by the resident doctors that, they will continue the nationwide protest as called by IMA. So definitely, if at all Mumbai and Maharashtra is concerned, they are together with the doctors across the nation, demanding justice and demanding implementation of the Central Protection Act, which is long pending demand by these doctors. Back to you.
All right, Abhishek, thank you so much for joining us, bringing us those important details. Also crossing over to my colleague Rishabh, who joins us at this point. Rishabh, is there anything that's posing an obstacle to the doctors' protests when it comes to, A, what they're able to do on the ground with the peaceful protests? What is the security personnel situation on the ground like? Also, let us know what exactly their demands are.
See, good morning, Aisha. First of all, if we talk about doctors' demand, the doctors' demand are very clear. Justice for what happened in Kolkata remains their primary demand, and CPA, Central Protection Act, is something that the doctor bodies are demanding, even at the Nirman Bhavan protest day before yesterday, when the doctors from various RDAs, be it Safdarjung, be it AIMS, be it Lady Harding, be it RML, when they gathered, about 500 doctors gathered at the Nirman Bhavan, the Ministry of Health. There, the demand was very clear that justice for Kolkata and a CPA. CPA, by that doctor, believe that if there's a Central Protection Act that will stop violence against medics in various hospitals in the country. IMA has supported it. IMA wants the hospitals to be declared secure zone to an extent like the airport is. They want further probe into what happened in Kolkata. They also want security for paramedics in hospital as well. So that is what IMA has demanded. They have asked Prime Minister to intervene and look into what's happening in this whole doctor protest saga. It's been almost 6-7 days since the protests are on. The OPD services, except the emergency services, the other elective surgeries and others are being affected, be it in AIMS, be it in Safdarjung or other hospitals here in Delhi. The IMA strike, Aisha, has been called off in the morning, but the RDA strikes continue. In some time, we'll get to know what their stand from today onwards would be.
All right, Rishabh, thank you so much for joining us, giving us more information on what the demands are. Now, let's actually take a look at a conversation with the IMA's national president.
We naturally welcome this. Whether it is adequate, what should be the response of Indian Medical Association will be decided after consulting all our state branches. But we also would like to bring to the attention of the doctors of this country and also the public and the media that there exists a document which is a memorandum signed by both IMA as well as the Health Ministry officials. And the government was the same. And the Health Minister was Shri P. Nadda ji. And that was in 2017. And this is the document that IMA has, which is a common document of the Ministry as well as Indian Medical Association, signed between both of us in 2017.
Now, shifting focus. In delayed action, the Mamata Banerjee government in Bengal has announced a slew of safety measures for female doctors in hospitals. These include the creation of safe zones with CCTVs and rest areas with toilets for women, ensuring presence of women security personnel or volunteers. The Bengal government has also announced the launch of a mobile app named Ratri Sati, which in English means a companion at night. The app aims to help women in distress make a direct SOS call to the nearest police station. The government also proposes to spare female doctors from night duty as much as possible, or even if they are given night shifts, it should be in pairs with another female doctor. Now, to ensure safety for women at state hospitals, medical colleges, hostels, and other places, breath analyzer tests of visitors will also be conducted at entry gates. Wearing ID cards has also been made mandatory for all staffers to help cops distinguish them with outsiders. The measures announced, however, are yet to be implemented. Crossing over to my colleague Adrija. Adrija, as we mentioned, this is a welcome move, but it is delayed action. Why wasn't this in place beforehand? We've read out some of the measures. What is the response that's coming in after these measures have been announced?
Well, you see in several places, the state administration is trying to bring in new technology and new equipment to ensure the safety and security of all the doctors in every medical college and hospital that they have been working, and also to ensure safety in general for everyone. So this launching of this app is just another part of this entire mission that the government is conducting, where they are, allocating funds and then they are holding several meetings to ensure that the safety and security of every campus, every medical college campus is maintained. And on the other hand, of course, this is a bit late. This should have been implemented way before we would have lost a life. But, as they say, that it is better late than never. So now the state government is actually stepping up, looking into the entire matter, and, is also expected. This entire launching of this app is also a part of that.